There are many types of emergency lifts and carries that the first responder can perform. If you find yourself by yourself and the patient needs to be moved from a precarious situation, you need to get them out fast. If they do not have a suspected C-spine injury, this can be done by coming to the patient's head. The patient may be unresponsive and unable to help themselves. So you'll need to lift the patient slightly and place your arms underneath the shoulders into the armpits. From this position, you really need to pull without injuring your back. You want to use your legs. Move your leg back, pull the patient towards you, move your leg back, pull the patient towards you. If you find yourself in a position where you have a second rescuer able to help you, you can now seat the patient into a seated position. The patient may be unresponsive and limp, much more difficult to grab a hold of. So what you need to do is take your right arm, hold on to the patient's left wrist, take your left hand, hold on to the patient's right wrist. Make sure you get a firm grasp. You want to be able to put yourself into a position where you're lifting with your back and not your legs. Rescuer number 2 will also get into position and place their hands below the patient's knees. Once you're ready to lift, you want to make sure that you do it together so you don't get injured. The command will be, ready?
Ready.
Go. From this point, the patient can be moved downstairs, can be put on a stretcher, placed in a chair, or wherever you need them to go.